Welcome back to Mangevity, and if you've ever felt that sinking feeling of finishing way too soon during sex, I need you to listen very carefully to what I'm about to share with you, because the 7 techniques we're covering today are not just random internet advice. These are actual medical protocols that doctors and sex therapists have been using successfully for decades to help men gain real, lasting control. Quick disclaimer before we start. This is educational content based on peer-reviewed research and expert medical consensus. If you're concerned about your testosterone levels or sexual health, always consult with a qualified healthcare provider. The truth is, premature ejaculation affects about 1 in 3 men at some point in their lives, which means if you're struggling with this, you're absolutely not alone. And more importantly, you're not broken. What you're experiencing is a treatable condition with proven solutions that work when applied correctly and consistently. Now, before we dive into these 7 techniques, I want to set the right expectation here. This isn't a magic pill situation where you watch this video and suddenly last an hour tonight. What we're talking about is training, the same way you'd train any other skill or physical ability in your body. These techniques work by retraining your nervous system, building muscle control, and teaching you to recognize and manage your arousal levels in real time. The research backing these methods is solid, with success rates ranging from 40% to over 80%, depending on which combination of techniques you use and how consistently you practice them. Doctors typically recommend starting with behavioral techniques first because they have no side effects, they cost nothing, and they address the root cause rather than just masking the symptoms. The first technique that medical professionals almost universally recommend is called the start-stop method, and it was developed back in the 1950s by a researcher named James Siemens. Here's how it works and why it's so effective. During sexual activity, whether solo or with a partner, you stimulate yourself or allow stimulation until you feel you're approaching the point of no return, which is typically around a 7 or 8 on a scale of 1 to 10 in terms of arousal. At that point, you immediately stop all stimulation completely and wait for about 30 to 60 seconds until that intense urge to ejaculate subsides and your arousal level drops back down to maybe a 4 or 5. Then you start stimulation again and repeat this cycle 3 to 5 times before allowing yourself to actually finish. What this does neurologically is incredibly important. You're teaching your brain to recognize the different stages of arousal instead of just going from 0 to orgasm without any awareness of the steps in between. You're also conditioning your nervous system to understand that high arousal doesn't have to immediately lead to ejaculation, which breaks that automatic reflex response that causes premature ejaculation in the first place. When researchers studied men who practiced the start-stop technique consistently for just 4 to 6 weeks, they found that average ejaculation time increased significantly, often doubling or tripling from baseline. The key word here is consistently, because you need to practice this during masturbation several times a week to build that neural pathway, and then gradually transition to using it with a partner once you've developed good control on your own. The second technique doctors recommend is closely related but adds a physical component, and it's called the squeeze method, developed by the famous sex researchers Masters and Johnson in the 1970s. With this technique, when you feel ejaculation approaching, you or your partner applies firm pressure to the head of the penis, specifically placing the thumb on the underside where the head meets the shaft, and the index and middle fingers on the top side, and you squeeze firmly for about 10 to 20 seconds. This pressure temporarily reduces the urge to ejaculate by stimulating specific nerve pathways and slightly restricting blood flow, giving you time to regain control before continuing. The squeeze should be firm enough to be effective but not painful, and after releasing the squeeze, you wait about 30 seconds before resuming stimulation. Many men find this technique particularly helpful during partnered sex because it gives both people an active role in managing the timing, and it can be integrated smoothly into intimacy without feeling too clinical or awkward. Now, here's where things get really interesting, and this is the part that creates some suspense because it involves a set of muscles that most men have no idea they can even control. The third and fourth techniques both involve your pelvic floor muscles, which are the hammock of muscles at the base of your pelvis that control urination, bowel movements, and yes, ejaculation. Most guys have heard of Kegel exercises for women, but men have the exact same muscles, and training them is one of the most powerful ways to gain ejaculatory control. The third technique is performing regular Kegel exercises to strengthen these muscles. To identify the correct muscles, one common method is to briefly stop the flow of urine during urination. The muscles used for that action are your pelvic floor muscles. Once you recognize them, you can exercise them anytime without anyone noticing. Simply contract the muscles by pulling them inward and upward, hold the contraction for 5 to 10 seconds, then relax for the same amount of time. Repeat this 10 times per session and aim to complete 3 sessions per day. Within a few weeks, these muscles become stronger and more responsive. Strong pelvic floor muscles can help delay ejaculation because they give you more control during moments of high arousal. However, there is an important twist that many people overlook. Some men actually experience the opposite problem. Instead of weak pelvic muscles, they have muscles that remain too tight or tense throughout the day. This tension can contribute to premature ejaculation because the muscles are already partially engaged before climax begins. For these men, the fourth technique, reverse Kegels, is extremely helpful. Instead of tightening the muscles, reverse Kegels involve gently relaxing and pushing the pelvic floor outward, similar to the sensation of beginning to urinate. You hold this relaxed state for several seconds before returning to normal. Practicing both Kegels and reverse Kegels allows you to develop balanced control, giving you the ability to contract or relax these muscles whenever needed. The fifth technique doctors often recommend involves breathing control. It might sound simple, but the science behind it is very strong. Your breathing pattern has a direct effect on your autonomic nervous system, which controls many automatic functions in the body, including ejaculation. When breathing becomes fast and shallow, which often happens during sexual excitement, the sympathetic nervous system becomes more active. This is the system associated with the fight or flight response, and it also plays a role in triggering ejaculation. Slow, deep breathing activates the parasympathetic nervous system instead. This system supports relaxation and helps maintain a steady state of arousal without immediately triggering climax. Practically speaking, this means focusing on calm breathing during intimacy. Inhale slowly through the nose for about 4 seconds, allowing the belly to expand rather than the chest. Then exhale gently through the mouth for around 6 seconds. The longer exhale is especially helpful because it enhances relaxation signals in the body. If you notice your arousal rising too quickly, deliberately slowing your breathing can reduce the urgency and help you regain control. When breathing techniques are combined with methods like the start, stop, or squeeze technique, they become even more effective. The sixth technique involves body awareness and tension release. Many men unconsciously tighten their entire body during sexual activity, including their thighs, abdominal muscles, and pelvic floor. This tension can accelerate ejaculation. Doctors often suggest performing a mental body scan during intimacy. Start by relaxing the feet, then the legs, the abdomen, and the shoulders. Pay special attention to the jaw because tension in the jaw often reflects tension in the pelvic area due to connective tissue links in the body. When the jaw relaxes, the pelvic floor frequently relaxes as well. Developing this awareness takes practice, but once it becomes natural, many men notice a significant improvement in stamina. The seventh and final technique is known as sensate focus. This approach is commonly used in therapy for couples experiencing performance anxiety. It involves setting aside time for physical closeness and touch without the expectation of intercourse or climax. Partners take turns exploring gentle touch and sensation while remaining relaxed and present. Because there is no pressure to perform, anxiety decreases and awareness increases. Over time, couples gradually reintroduce intercourse with greater comfort and control. Clinical research has shown that this approach can achieve success rates above 70% when practiced consistently for several weeks. Each of these 7 techniques is effective on its own, but they become even more powerful when combined. Breathing control and body relaxation create a calm foundation. Pelvic floor training builds physical control, and the start, stop, or squeeze methods strengthen awareness and stamina. With consistent practice, real improvement is absolutely possible. If you are benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.